Hello everyone! Welcome to our video where we will explore 13 unusual symptoms that may show that you have liver damage. It is very important to know these signs so you can take measures to prevent the worsening of the disease. Sometimes, people believe that liver damage is primarily due to excessive alcohol intake. This is to an extent a false belief. Here's why. Causes of liver disease. Eating an excess of sweets, processed foods or drinks, or having an excessive consumption of omega-6 rich vegetable oils and fast foods, or having a frequent use of painkillers such as acetaminophen or ibuprofen, leads to liver damage and hepatitis, which contribute towards liver disease. If you want to check for liver problems, keep watching this video until the end. I will also recommend some simple home remedies to detoxify your liver and prevent any further damage. Symptoms of liver damage. Symptom 1. Light-colored stools. The first symptom of liver damage is the passage of pale bowel movements when you defecate. Your liver is responsible for releasing bile acids that are used in the breakdown of fats in the digesting food, hence the color of your stool is brown. However, if one is affected by fatty liver disease or liver problems, the flow of this bile can be obstructed, and this leads to light or pale-colored stools. At times, the stools may even be able to float in the bowl water since they are light as a result of undigested fat. Symptom 2. Difficulty with night vision. This sign is due to poor night vision. If you have a problem in seeing well in the dark or at night, there is a possibility that you may be suffering from a retinol, vitamin A deficiency. One of the significant functions of bile that is produced by your liver is to aid in the digestion of fats with vitamin A, which is useful in the adjustment of light receptor cells in the eyes. However, liver disease affects this process and leads to poor absorption of vitamins, and thus the condition referred to as night blindness. Symptom 3. Right foot swelling. When the blood flow in the liver is poor, then the liver becomes swollen and enlarged, thus applying pressure to the portal vein. Hence, it can lead to swelling of the legs or feet, or what is referred to as fluid or water retention. Sometimes you can apply pressure on the affected part with your finger, and it will remain indented for some time. In case you have realized that your right foot or the ankle region is more swollen than the left one, this is the sign of possible liver damage. In the latter part of the video, there are recommended ways on how to enhance the liver's functioning naturally. Symptom 4. White growths on eyelids. One more sign that refers to the problem with liver is the presence of small rounded white or yellowish formations around the eyes, specifically the eyelids. These are small cholesterol deposits that form under the skin as a result of the liver's failure to metabolize cholesterol, which hence accumulates in different tissues of the body. Symptom 5. Pressure on the right side. A sign that may be linked to liver disease is pressure or pain in the right side of the chest that occurs after eating. The liver also affects the bile production. When it is damaged, the bile thickens and slows down. The small tubes that connect to the gallbladder may become blocked, hence the feeling of pressure and uneasiness around the ribs develops. This pressure can also affect the phrenic nerve. This may result into muscle tension and pain at the region around the right shoulder. Symptom 6. Purple and red spots. When the liver is congested, inflamed, or damaged, it synthesizes less protein required to ensure proper blood clotting. For this reason, you may bruise easily, and at times you'll realize you have unusual purple or red spots like a rash on your skin, as well as small red dots. This commonly affects areas of the body, such as the lower limbs or the limbs, and is because of poor blood circulation occasioned by liver diseases or conceivably diabetes. Symptom 7. Cracked heels. Vitamin B3, commonly referred to as niacin, is vital in maintaining the elasticity and moisture of the skin so that the skin does not crack. Niacin deficiency is also a cause of skin disorders, and one of the symptoms is cracked heels. This deficiency can be caused by poor absorption of nutrients, that is, as a result of liver damage. Symptom 8. Liver damage and niacin. When one is affected with the liver disease, the body moves its niacin for the repairing of the liver tissues, thus providing less amount of this vitamin to the body. This can result to dryness of the skin on the sole of the feet and the heel, hence causing cracking of the skin. One way that you can counter this is by ensuring that you take foods that are rich in vitamin B3. Symptom 9. Persistent itching. Another sign that one may exhibit when they have liver disease is itching, especially at the back of the palms of the hands or the soles of the feet. This is a condition given by the failure of the liver to filter bile acids which then deposit under the skin. This accumulation causes the release of histamines in the bloodstreams, which in turn cause the itching feeling. However, it is recommended to seek medical advice before self-diagnosing and treating yourself. Symptom 10. White or clubbed nails. If your nails became completely white, lose their natural pink hue, or look like clubs or bulbs, it is recommended to visit the doctor to check for liver illness or any other disease. This situation may hinder the supply of oxygen to the nail matrix. In the 1950s, 80% of patients with advanced liver cirrhosis had completely white nails. Symptom 11. Dark urine. Your liver is involved in the breakdown of old red blood cells, as they contain a yellow substance known as bilirubin. When your liver or gallbladder is diseased, this pigment is retained in the body and later excreted through the urine. Thus, your urine may turn a dark amber, orange, brown, or cola-like color, simply because your liver is unable to metabolize the pigment properly. Also, some drugs such as antibiotics, sleeping pills, or contraceptives can also cause this discoloration through exerting pressure on the liver. Symptom 12. Yellowish skin. In this case, the skin color is affected because the liver fails to perform its role of filtering bilirubin from the blood. This may lead to a color change of the skin to yellow known as jaundice. The first sign of liver damage, or liver disease, is jaundice. Symptom 13. Spider veins. Spider veins refer to the appearance of small red spots on the skin with spider-like branches of blood vessels. These are blood vessels that have become weak since your liver cannot filter out excess estrogen. The estrogen hormone has a direct effect on the blood vessels in the veins. High levels of this hormone cause the blood vessels to become weak and are therefore dilated and give way to these spider veins on the skin. If you encounter any of the above discussed symptoms, we would greatly advise you to go and see your doctor. How to reverse liver disease. As mentioned earlier, the liver goes through 4 distinct stages of damage. First, the fat deposit, then inflammation, and then finally, a tissue known as fibrosis is formed. It eventually reaches the last and possibly lethal stage, which is cirrhosis. Let's go over the most important steps to reverse liver damage. 1. Improve your diet. Avoid taking foods with added sugars like candies, cakes, biscuits, syrups, sauces, pastries, and soft drinks, starchy foods like rice, potatoes, and pasta, and foods made from flour such as bread, cookies, and pancakes. A fatty or damaged liver reacts to fructose, the sugar found in fruits, as it does to alcohol. 2. Incorporate bitter and sulfur-rich foods into your diet. These include kale, spinach, and other green leafy vegetables, artichokes, radishes, garlic, broccoli, Brussels sprouts, cabbage, mushrooms, eggs from pastured animals, wild salmon, fatty fish, walnuts and onions, scallions, and broccoli sprouts. It is also good to consume products containing sulfur because it contributes to the synthesis of glutathione and the removal of toxins that lead to fat deposition in the liver. 3. Start your day with a cup of homemade organic coffee with turmeric. The polyphenols present in coffee and phytonutrients present in turmeric are beneficial in the prevention and healing of the scar tissue formed in the liver due to alcohol, drugs, or fructose consumption. Also, it is recommended to drink not less than 1 liter of mineral water of the highest quality in a day, as it contributes to the dilution of the blood and the stimulation of the production of bile by the liver, enhancing the filtration of toxins. The knowledge of the symptoms of liver dysfunction, as well as the ability to distinguish them from other signs, is important for timely action to stop the progression of liver disease. The liver is one of the most vital internal organs in the human body and has the ability to regenerate itself. It is mainly responsible for detoxifying the human body, metabolizing nutrients, and producing important proteins. However, it can be affected by many factors that include alcohol consumption, taking unhealthy foods and beverages, using some drugs, and infections. The light-colored stools and the problem with night vision, the swollen right feet, and the spider veins all may indicate liver problems. These may appear to have no connection to one another, but they all point towards the fact that liver plays a role in almost every function of the body. For example, a shift in the color of stool or the development of clubbed nails brings out how liver disease is usually accompanied by changes which at first glance may not be serious, but are very significant. Skin itching that lasts a long time or dark-colored urine are signs of how important the liver is in metabolizing and excreting toxins. In case one identifies any of these symptoms, it is crucial to seek medical attention immediately. An early diagnosis is always useful because it will help the patient seek medical attention as soon as possible. Last but not the least, avoiding sugary and starchy foods and including sulfur and vegetables in your diet can help to manage the condition of your liver to a great extent. Some of the foods that help activate the liver's detoxification pathways and prevent fat buildup include green and other leafy vegetables, artichokes, garlic, and broccoli sprouts. It is possible to continue the protection of liver cells by consuming a cup of organic coffee with turmeric in the morning, as these ingredients possess anti-inflammatory and antioxidant effects. Also, consumption of mineral water that is recommended to aid in the secretion of bile, which plays a role in the digestion of fats and toxins. These changes in dieting, along with physical exercises and quitting the use of increased alcohol content and not taking unnecessary drugs, are some of the ways that can help in the healing of liver and other related complications. Therefore, my dear friends, I suggest you select one of these steps and proceed to the path of healthy and happy life. See you the next time.